Elsevier Pharmacology Hesi. Question 1. Drug increasing digoxin toxicity? Phenytoin, verapamil, warfarin, antacids. Verapamil increases digoxin levels. Question 2. Digoxin teaching? Call HR less than 60. Pulse 30 seconds. Increase sodium. Take with food. Bradycardia indicates toxicity. Question 3. Which is not a side effect of loop diuretics? Alkalosis, nausea, hypotension, potassium loss. Loop diuretics cause electrolyte imbalance, not commonly nausea. Question 4. Which is not a side effect of clonidine? Hypertension, breathing difficulty, dry mouth, lethargy. Clonidine lowers BP, hypertension is not a side effect. Question 5. Aspirin long-term complication? Hemorrhagic stroke, thrombotic stroke, anemia, neutropenia. Antiplatelet effect increases bleeding risk. Question 6. Atorvastatin monitoring? Glucose, CK hemoglobin, sodium. Elevated CK indicates muscle damage. Question 7. Metformin adverse effect? Sleepiness, constipation, fluid retention, weight gain. May indicate lactic acidosis. Question 8. Which stroke should not receive thrombolytics? Hemorrhagic, thrombotic, both, neither. Thrombolytics worsen bleeding in hemorrhagic stroke. Question 9. Levofloxacin teaching? With food. Avoid dairy. Bedtime. Increase potassium. Calcium reduces absorption. Question 10. Atenolol should be held for which vital sign? RR12. Pulse 52. BP 134/72. O2 95%. Beta blockers lower HR, bradycardia is a contraindication. Question 11. Rameltian teaching, what food to avoid? Potato, fried chicken, whole grain, citrus. High-fat foods delay absorption. Question 12. Zolpidem teaching, what instruction? Notify if pregnant. Take 1 hour before sleep. Sleep 6 hours. Avoid snacks. Zolpidem is unsafe in pregnancy, notify provider. Question 13. Metoclopramide use? Constipation, gastroparesis, diarrhea, IBS. Improves gastric motility. Question 14. Insulin peak 1 A/5 HRS? Glargine, NPH, regular, Lispro. Regular insulin peaks midrange. Question 15. For alteplase for PE, what should provider do? Give enoxaparin. Apply pressure. Give aminocaproic acid. Give within 8 hours. Pressure prevents bleeding at puncture sites. Question 16. Which is not related to ibuprofen toxicity? Nausea, renal dysfunction, anemia, muscle wasting. Ibuprofen affects GI and kidneys, not muscle tissue. Question 17. Amoxicillin plus clarithromycin teaching? Take with food. Black stool. Photosensitivity. Decrease acid. Food reduces GI upset. Question 18. Which is not a side effect of nifedipine? Nausea, flushing, vertigo, sexual dysfunction. Sexual dysfunction is not typical of calcium channel blockers. Question 19. Furosemide adverse effect? Hyperkalemia, hyponatremia, hypernatremia, hypercalcemia. Diuresis causes sodium loss. Question 20. Why is clopidogrel given after stroke? Prevent valves. Lower BP increase HR antiplatelet effect. Clopidogrel prevents platelet aggregation and reduces clot risk. Question 21. Which drug is associated with hepatitis? Valproic acid, quinidine, isoniazid, ethosuximide. Isoniazid can cause hepatotoxicity requiring monitoring. Question 22. Nitroglycerin teaching, which is not included? Tachycardia, dizziness, hyponatremia, hypotension. Hyponatremia is not associated with nitroglycerin. Question 23. Which of the following conditions is not treated with methotrexate? Sarcomas, leukemias, ectopic pregnancy, rheumatic fever. Methotrexate treats cancers and ectopic pregnancy, not rheumatic fever. Question 24. Propranolol contraindication? MI history, warfarin use, SSRI, heart block. Blocks conduction further. Question 25. Potassium-sparing diuretics act where? PCT loop, collecting duct, distal tubule. They act in distal nephron to conserve potassium.